think I need a woman in my life. You know, someone to keep me company, keep me on track. It'd be great, I feel like. Maybe I'll try that match thing.
There is a time when a man needs somebody to talk to. Someone to talk to, somebody who'll always be there.
Hello, Sally.
Oh, hey, Bob. How are you? Nice to meet you.
Well, Sally, I'm doing all right, but I just had this knee surgery a few days ago, and I'm still in some pain. But it's sure nice to be out and about and enjoying the world again. I couldn't help to notice the white coat. You wouldn't happen to be a nurse, would you?
I sure am.
Well, I'm on these pain meds, and I had this knee surgery 6 days ago, and I kind of just don't understand why I'm on the drugs that I'm on.
Oh, sure. What are you taking?
Well, this is kind of what they gave me.
Oh, let me take a look. Let's see. Okay, yep, exactly what I suspected. Enoxaparin, subcutaneous injections, 30 milligrams every 12 hours, 12 to 24 hours after surgery for 7 to 10 days. And you do know how to take this medication, correct?
Oh yes, I've been giving myself medications in my right and left abdominal wall.
Perfect.
The only problem is I don't understand what it's doing.
Oh, okay. Well, I'll help you out here. So enoxaparin is a low molecular weight heparin whose mechanism of action is antithrombin dependent. It is given to patients after knee or hip replacement surgery, abdominal surgery, unstable angina, and non-Q-wave myocardial infarction. So in your case, after your knee replacement surgery, you were prescribed this medication to reduce the risk of developing deep vein thrombosis. Deep vein thrombosis is formation of blood clots in veins located deep within the muscles, usually in the legs. Enoxaparin changes the blood's normal clotting course by binding antithrombin to factor Xa, suppressing the formation of thrombin and making it harder for clots to form. This helps prevent a potentially and fatal pulmonary embolism. Make sense?
Yeah, I think that makes sense.
Great. So have you experienced any side effects on this medication? Perhaps diarrhea, nausea, excessive bleeding, fever, heart arrhythmias, rash, pneumonia, neurological impairment, allergic reaction?
No, none of those.
Great. All right. So I'm sure the surgeon made sure you weren't taking any meds that are contraindicated or could interact with enoxaparin, but just a reminder, avoid oral anticoagulants, non-steroidal anti-inflammatory agents, platelet aggregating inhibitors, and drugs containing dextrin or ASA for the possibility of interaction with blood clotting mechanisms and the risk of excessive bleeding or hemorrhage. It actually does contain a black box warning stating the possibility of epidural or spinal hematomas, which could result in permanent paralysis. Any questions?
No, I think that covers it. Thank you. But I really
Hello, my name is Taguhi and I'm going to be your nurse today.
Hi. I'm Kara. This is my Grandma B.
Hi, nice to meet you.
What?
Nice to meet you.
She's
My
hard
name
of
is
hearing.
Taguhi. I'm your nurse today.
Who's she?
She's your nurse.
Oh, okay.
How are you doing today?
Good. So we're here because Grandma's had high blood pressure for the past couple of months.
Oh,
We came to
okay.
see the doctor. The doctor gave us this med, 30 milligrams a day. But what's this for? What do we do?
Let me take a look. This is lisinopril. It's used to treat high blood pressure as well as congestive heart failure and acute MIs. What it does is it blocks.
You can just call me cute.
You are cute. So what this does, it's an ACE inhibitor, so it inhibits angiotensin 1 from converting into angiotensin 2. And what that does is it decreases the levels of aldosterone and increases bradykinin. And what ends up happening is that your blood vessels don't constrict anymore, so your blood is able to move more freely, and that lowers your blood pressure and it increases your cardiac output. Does that make sense?
Yeah, that makes sense. Do you get it, Grandma?
Yeah, you're going to have to repeat that to me later.
Sure. We'll go over it again.
Alright, so there might be some side effects that you may experience, including headaches, dizziness, hypotension, coughing, elevated potassium, elevated BUN and creatinine levels, and there are some serious side effects including kidney disease, anaphylaxis, cholestic jaundice syndrome, agranulocytosis, neutropenia, and angioedema of the head and neck.
Wow.
And alcohol should not be used while on this medication, okay?
No wine, Grandma.
I'm sorry.
Sorry. We'll substitute. We'll have grape juice nights.
Oh, that should be fun. Well, here you go. Do you guys have any more questions for me?
Look, it's up. It's up. What should we do now?
Is it that time again?
Yeah, honey. It's that time again.
Baby, you and your high cholesterol, you have to start watching what you eat.
I have been. Do you think they'll put me on medication?
If they do, it'll most likely be simvastatin. It'll help lower your cholesterol and help lower your chance of heart disease. For all you science people, simvastatin is a specific inhibitor of HMG CoA reductase, the enzyme that catalyzes the conversion of HMG CoA to mevalonate, an early and rate-limiting step in the biosynthetic pathway for cholesterol.
Dear meds, what are the side effects?
Well, it may cause abdominal pain, constipation, nausea, vomiting, and upper respiratory infections. Contact your physician if you develop any allergic reaction for any musculoskeletal effects. Do not take if you're breastfeeding, pregnant, have active liver disease, or using gemcitabine, cyclosporin, and Janus.
I know you haven't seen me before, but I'm taking over for the night nurse.
I prefer to be Captain.
Captain. All right, Captain.
Clarity.
I was informed that you were admitted through the ER because of an acute MI. And the doctors just informed me that you have rising cholesterol, which concerns me, and you need to go on an anticoagulant and are at risk for an ACS MI due to the chronic angina.
Hey, that's nice.
I'm sorry, can you speak up a little bit? I'm a little hard of hearing.
Okay, how about I just come over a little bit closer so you can
Okay.
hear me?
That's very nice of you. I forgot my hearing aid at home today.
Oh, all right, I'll just talk a little louder.
So what's going on with my husband?
We ran a few blood tests and did some labs, and everything's to come out okay, except for we have diagnosed him with hyperlipidemia and potential risk for acute coronary syndrome.
Hyperacute, what?
It's just a fancy term for high cholesterol. It can normally be controlled with a better diet, exercise, cessation of smoking, and drinking normally. But seeing here how he has chronic not use of this, the doctor is concerned for his risk of plaque buildup and could potentially result in a myocardial infarction. Stroke.
Oh dear.
Hey.
So how can we lower his risk of having that?
Well, for starters, we're going to put him on a very successful anticoagulant called Plavix.
I think I've heard of that. How does that work? Are there any side effects?
I'm so glad you asked. Plavix is administered to help patients who are at risk for the buildup of atherosclerotic plaques due to recent MI, strokes, some of the things that Arthur has been prone to. It is prescribed for those, and the mechanism of action is an anticoagulant, antiplatelet agent, as well as being an antithrombotic. More specifically, it's a CYP450 enzyme that inhibits the binding of ADP to its receptor sites on the platelets to metabolize it. It's also a substitute for patients who are unable to take aspirin. It'll thin his blood so that clots can't form, which will block his heart and eventually his arteries.
That's okay. I understand that. I think that's going to be helpful for my husband.
Yeah, it has a good reputation, but be careful when you administer it to Arthur. It should be given orally with or without food, and the goal is to get his blood thin to a certain extent, but too little or too much can have adverse side effects.
So what are the side effects?
Oh, another good question. Arthur could experience any of the following, such as chest pain, headache, flu-like symptoms, pain, dizziness, diarrhea, rash, rhinitis, depression, and occasionally urinary tract infections. But if any of these bother him, please don't hesitate for him to come back, and we could maybe put him on something else.
Okay, that sounds good. He does have other drugs that he's taking right now. Are there any interactions with those drugs?
It does induce you to have thin blood, so you should be careful with using over-the-counter things like NSAIDs, such as Tylenol, aspirin, Motrin, so you should probably avoid these. You also shouldn't take it if he's ever put on warfarin because it will inhibit the liver enzyme. And additionally, Plavix should not be given to him if he has an active chronic bleed, including ulcers or intracranial hemorrhage. Does he have any of those?
Oh no, he doesn't.
Okay, perfect.
Hey, can I still go sailing?
Yes, of course you can still go sailing. But just be careful because a bump of the head or laceration it will inhibit your bleeding, so you could bleed out and bleed profusely and lose a lot of blood. So we want to be very careful, when you're getting on and off that ship.
Okay, well, thank you very much. You were very helpful today.
Of course. Feel better, Arthur.
Where's this girl? Oh, Mrs. Peacock. Thank you for waiting. You know you're taking a long time. I have stuff to do now.
I am so sorry. I'm just a little concerned. I see you've missed your last few clinic appointments to get your PT checked. You're on warfare.
I don't need all that PT and TB. I don't need that stuff.
Okay, well, do you understand how warfarin works? You see, warfarin is an anticoagulant that functions by interrupting the vitamin K oxidation cycle. Coagulation factors 2, 7, 6, and 10, and proteins C and S are manufactured by the liver in a process requiring vitamin K. Before vitamin K can work to produce these coagulation factors, it must be activated by vitamin K epoxide reductase complex 1, or VKORC1. Warfarin inhibits the VKORC1 enzyme, preventing vitamin K activation, thus interrupting the synthesis of the necessary factors for coagulation. The biggest concern with a blood-thinning medication is that it actually thins your blood, and so you're at greater risk for bleeding and hemorrhage. Do you do any contact sports?
When I have time, I like to play football. I think you Americans call it soccer.
Yes, soccer, yes. You just need to be very careful. If you do have any physical contact with someone, you want to watch those sites. Look for any bruising, swelling, apply ice immediately, and contact a physician immediately if you feel that your blood pressure is low or if you notice any dark, tarry stool.
I don't think I'll have that problem. I'm very fast.
Please keep in mind that warfarin is a teratogen, so we want to take you off of it or consider an alternative before you might get pregnant or breastfeed.
I'll think about that one.
All right.
I will call you if me and my man decide we want to have baby.
All right. Thank you, Mrs. Peacock. It's been good to see you today.
Thank you for your time. I appreciate it.